Now we'll finally get to what can be done in a solo or small group office setting. First, the case report. During literally every chiropractic seminar that I've attended, I hear at least one doctor relate an anecdote. A patient came in with XYZ, she was adjusted this way or that, which had an excellent outcome. Sound familiar? The difference between an anecdote and a case report is the level of detail. An anecdote is often told in a manner similar to a soap note. Patient came in with, on examination I found, I did this or that. The result was. A case report follows a similar format, however, the details are greatly expanded. For example, for the subjective, you might say, a well-conditioned 41-year-old white female with the chief complaint of headaches was seen. Descriptors as to the onset, duration, frequency, quality, and locations of pain are stated. Headaches are provoked by X and relieved with Y. All of the important details elicited during the patient intake interview, negative and positive, are reported. A similar detailed discussion of the examination findings are reported in the objective section. This includes your observations such as gait, posture, pain behavior, physical examination findings, imaging, and laboratory. These results may have taken place over days or weeks, therefore the chronology should be reported. It's best to include outcomes measurements. The measurement of choice is dependent upon the type of case. It can be a pain scale, blood pressure, weight, C-reactive protein, bone mineral density. The point is to apply the most relevant objective measurement to the patient's situation on entry, during treatment, and at dismissal. The composite of the subjective and objective should be drawn together to express your hypothesis or working diagnosis. You might also state why other possible diagnoses were ruled out or considered improbable. The case report is a story. It is an in-depth discussion of a particular situation rather than a sweeping statistical survey, and it reflects the way in which doctors in the field practice, seeing one patient at a time. The case report does not require special infrastructure, nor is an institution review board needed. Continuing to build your case report, you would then describe the chosen treatment or treatments in detail. This can be aided with photographs as long as the patient's identity is protected. You don't just say, I adjusted C2. Instead, you describe the technique, how often, for how many visits, the response, any measurements of improvement, effect on activities of daily living if applicable, or if this was an athlete, how did their performance change pre and post treatments, and were there any other factors that may have influenced this? Details about how the patient responded after the initial treatments must be stated. Ideally, follow-up after weeks or months should also be described with objective findings as well as the patient's reported subjective changes. Once the story is complete, a case report often includes a review of the relevant literature, other studies, and cases discussing headaches. This need not be a complete literature review. These are some of the common sites used for searches. I like Google Scholar as it's easy to use, thorough, and free. We'll enter headache and chiropractic and hit the search button. Many articles are shown, all from index journals. Here is a review article. We can narrow the search to 2018 to present. Here is a case report and another case report. Any article can be seen with just a click. The last section of the report is often called discussion. Here's where you summarize your reported case and editorialize about some aspect of the subject, the incidents, impacts, medical treatments, and/or a discussion of how you believe the treatment rendered was effective. There are no hard and fast rules other than making the distinction between your hypotheses and what is known as per other studies.
The discussion piece is where that's where you get to say, this is unique. I discovered this. I mean, I found this, and this is really uncommon in the usual office. And that if you've got some background data on how often this occurs in the general population, let alone reported by chiropractors, and then compare and contrast what you have found on all in all your parameters to that which is published in the literature, and then what's the point of this? Where can this go?
Okay.
And why should people pay attention? And then what additional investigations would help those into the future, whether it's a treatment or better screening, better diagnostic tests, or other diagnostic tests or things that could pick up.
Case reports can help to identify new clinical issues and may lead to the development of hypotheses. However, they are normally regarded as low-level evidence, as the observations may be subject to bias. But don't underestimate the value of the case report. If you observe a new way to diagnose or treat a given patient or condition, and other case reports are written citing similar findings, the composite of evidence may prompt a more in-depth research trial.
The challenge to every provider is to prevent what you treat. And all of a sudden I went, oh my God, that sounds fantastic.
Sounds like a case study, doesn't it?
Yeah.
So it sounds like in your career, you switched from being a treating provider to a prevention mode on the worksite prevention. This paper, published in the Journal of the Canadian Chiropractic Association, is an excellent resource for preparing your first case study. And here are 3 more papers to consider for helping you to perform and write a case report. But you are still not done. Your paper needs footnotes. It's vital that you give credit to authors from previous articles, to not cite references to commit plagiarism. If you quote another author, the sentence or paragraph should be in quotation marks with a footnote immediately following. A comment should be included in regard to conflict of interest. If there is any potential conflict, it should be disclosed. If there is no conflict, a simple statement saying, "The author states no conflicts of interest," will suffice. This type of study, the case report, is perfectly matched to individual chiropractic offices. Clearly, there is some commitment in both time and efforts to complete such a project. Here are some of the benefits to keep you going. I'll expand on these in a moment because you are still not done. After collecting all of the information, data, photographs, lab reports, etc., your paper needs to be written, edited, and formatted. Each of the journals to whom you might submit your manuscript will have author's guidelines. These are found on the journal's website under headings such as submissions, author's guidelines, or writer's guidelines. The guidelines for case reports or case studies will differ from that of a randomized control trial. The journal will state their preferred font, the format for photos and graphs, as well as the footnotes and the body of the paper. As long as you follow the instructions, your paper will pass through the initial phase of the review. Ignoring the journal's stated preferences often invites a rejection and avoidable frustrations. Also, your manuscript should only be sent to one journal. If they reject it, then submit to another. Do not simultaneously submit to multiple journals. If this is your first manuscript, you should consider having it edited by someone from the chiropractic school that you attended. If they make minor edits, include their name in the acknowledgments. However, if major edits are needed, you should invite them to become the secondary or tertiary author. Once accomplished, you are ready to submit your manuscript in the journal's preferred manner. A few more clicks on the computer and you are on your way to being published. This is exactly what I am hoping that we can do more of, where we have doctors in the field who know how to produce very well, but the academic portion of the team rounds it out, so now the published paper is a finished product that's worthy of the journals.
Sure. There's so many different ways to skin this cat, and I think the challenge for providers is one, expertise and a bit of like the uncertainty of knowing, like, even publishing a case study, even though there's been several articles, like in JMPT, I know there was an article on like these are the steps that you follow to do a case study. I still think that there's just a lot of apprehension. There's just this fear that I may not do it correctly, so I don't even want to try it. But I think you and I know that many times large scale clinical trials start with someone reading a really interesting and important case study. And so I've got friends of mine who do really great work in the field of pediatrics and chiropractic neurology. And I'm like, hey, you're going to publish that case? Because that's so cool. Because they'll present it on stage, right, when we're speaking. And then I'm like, hey, you should publish that. And they're like, yeah, but I'm afraid I don't know how to do it. And then I send them the link, to the JMPT article on how to write a case study. And it doesn't always get done because honestly, I understand there's so many competing priorities. But if a doctor can set aside a little bit of time, who knows, that case study literally might change the world.
You know what? Everything is scary when you don't know how to do it, but do it. And then once you've done it, it's not scary. And then each time you do it, you get better at it. If there's one thing I can leave a message, that is reach out and ask for help if people need help or would like, if somebody were to call me and say, hey, I do have a great case study, Dave. I have no idea how to get going, in which actually I've had that conversation with many, many, many DCs.
Here is a list of many of the peer-reviewed journals in the chiropractic profession. Index journals have the highest status and are searchable through databases. As the journal receives your paper, it is prepared for their editorial board, where it will be sent to 2 or 3 reviewers. The reviewers receive the paper but are not told the identity of the author. They make their comments and recommend to reject, accept as is, or accept pending revision. If the paper has merit and is a good match for the journal, this last category is a common answer. This process will take 4 to 12 weeks. The revisions may include specific comments for greater detail or questions about other case reports on this topic. Anything is possible. Keep in mind that the reviewers volunteer their time to help improve your paper. If you disagree with the requested revisions, you need to submit your rebuttal in a cover letter. It is best to be respectful and thorough. Once the revisions are made, your second submission will be reviewed. The second review typically takes less time than the initial review. It's possible that an additional revision will be asked, but it is also likely that the first revision will lead to acceptance. If the reviewers recommend to accept, they will inform the editor, who, in turn, will inform you of the acceptance. Congratulations, hallelujah, mazel tov. Actual publication may be in months following the date of acceptance. The editor will tell you of the planned date and will send to you an agreement about signing over the copyright to the journal. Yes, you give up your rights. The process is the same, whether the journal is in print or online. They will submit for your review the copy as it is formatted for publishing. Additionally, they will offer to provide you with reprints, copies on high-quality paper of the article. They charge for this service. You'll want a surprising number of these. Think a minimum of 50. Be certain to understand your obligations to the journal as to when and how you may or may not distribute your print or digital article. I mentioned benefits, both tangible and intangible. Here we go. Seeing your name in print following your efforts in completing the case report is more than gratifying. Not to mention that you can send a copy to your parents or your older brother or the kid down the street who you never liked or anyone else.
It was difficult to get practicing DCs involved in collecting data because they were afraid of the process.
What fear? I mean, what was it? The fear of rejection? Was it the fear of beginning? What do you think?
Exactly. It's the fear of beginning. I think the first paper I ever wrote, I was scared to death, that it would be a failure. And I remember I had a patient who was a teacher, and so he said, Dave, come on, just write one sentence at a time. And if you put down your thoughts, you're going to do good. You can groom it. And I wrote that paper and sent it in, and it got published. But I think it's the fear of what we don't know, right?
Okay. And so go back to that time. So you got published. Tell me about, did that open other doors for you, or?
Well, it gives you confidence. And that's really what it does when we're full of ideas.
A reprint of the published article should be shown to all those who work with you, as well as posted in the patient area of the reception room. This gives your staff and patients another reason to talk about you. If you are new in practice, this can be an important and excellent marketing tool, one that you are not paying for with cash. If you've been in practice for years, this internal marketing may act to displace some of your external advertising costs. Another tangible benefit of this published article is that you can send a press release to your local newspaper. If you're in a small town, this is news and fit to print. You can also send a reprint to any of the local physicians, suggesting that they consider referring patients to you who don't respond to medical therapies. Why not? If you have a large practice and hire associates, you can put in their contract that they have to submit a publishable paper within their first 12 months. This can help to build their practice, or, if needed, it gives you a justifiable reason to end the contract. And for the profession, your plus other case reports are the basis for further research. When several practices publish case studies about a given type of patient or disease, this now makes it easier for a chiropractic college to win a grant to perform a randomized controlled trial. This in turn may lead to expanded opportunities for doctors in the field. It's not a quick process, but a crucial item for the profession.